And so wanted to add some certainty to some uncertain times, and therefore directing all schools to be closed until May 1st. As we get nearer to May 1st, we may have to close permanently.
The end of the school year may have already happened. Governor Eric Holcomb announcing several more directives to stop the spread of the coronavirus, and they include keeping students at home for the foreseeable future. Tonight, we're hearing from school parents concerned about the extended closure and access to e-learning.
News 8's Julia Dang is live at the State House. And Julia, education officials are trying to get more devices to students.
Yeah, Brooke, that was a key point that came up during the governor's briefing here. But the shortage of e-learning devices is not the only challenge. Tonight, I talked to a mother venturing out with her kids despite pandemic fears. She says because she can't afford Wi-Fi at home.
If, by some miracle, we get students back this year.
Governor Eric Holcomb extending the closure of all Indiana public schools in an effort to contain the spread of coronavirus.
So I'm canceling Indiana's student assessments.
All state testing now canceled. Indiana School Superintendent Jennifer McCormick vowed to ensure high school seniors still graduate on time, applauding the state for shortening the 180 days of instruction typically required each year.
What that means is for schools who are not taking advantage of e-learning, that they don't have the mechanism to do so or have made a choice not to do that, they do have 20 days that will be counted as instruction.
McCormick indicated the 20-day waiver could be extended. IPS parent Siobhan Van is worried about the impact on her 3 children, saying e-learning isn't the same as classroom teaching.
You just throw them in the next grade, they're not going to be ready.
Only about half of Indiana districts have enough e-learning devices for each child to take one home. And not all of them are optimal for education.
Diligently working on how to get devices home other than a phone, because when you ask families, are you connected, and they say yes, and it's a single phone, it's difficult to run e-learning on a single phone. So we're looking at access. We've worked with some partners. We've sent out free resources. There is a gap, and I'm not going to pretend that there's not one.
April Bronner, a mother of 2 in Summitville, says her twins have devices, but she's on disability and can't afford Wi-Fi. She's been driving them to a friend's home so they don't get left behind.
With this virus getting worse and everything, trying to keep them from going out, and the school expects me to go sit in the parking lot for 2-3 hours for them to do their e-learning, and I don't think that's acceptable, period.
Bronner says public education shouldn't be a luxury, even during a public health crisis.
School districts should offer free Wi-Fi to families that cannot afford it.
Now, we want to let you know there is a free homework hotline available most nights of the week. Rose Holman students can help with math and science questions. We'll have a number for that hotline online at wishtv.com. Live downtown, Julia Dang, Wish TV, News 8.
Julia, thank you very much. Well, in addition to closing schools until May 1st, the governor also announcing that he would delay the state's tax filing deadline until July 15th. The state also blocking all new foreclosures and evictions. Governor Eric Holcomb also says that we should expect changes to the primary elections currently scheduled for May 5th. He says that date could change.
Out of first concern for our county officials that have to conduct these elections, our poll workers and voters themselves. And now the details have to be worked out, and the Secretary of State is running point on that. But I'll support ultimately the decision to postpone our primary election.
Governor Holcomb says that he plans to meet with Indiana's Secretary of State, and that announcement could come later this week.
Okay, so let's look at the updated coronavirus numbers from the state. 17 additional cases have been confirmed by the Indiana State Department of Health. That brings the state's total to 56. 380 people have been tested, including 187 yesterday. 2 Hoosiers have died. That number is unchanged since earlier this week. An Indianapolis doctor issuing a warning tonight to take COVID-19 seriously after she treated a patient who showed what she called terrifying symptoms that she believes were from coronavirus. News 8's Jenny Drasler has the story.
It was very scary, and I think it made it real for all of us and all our staff.
Dr. Teresa Krieger is still shaken up more than 24 hours after what she witnessed Wednesday morning. Krieger has her own family practice near 90th and Meridian on the north side. She says a woman in her late 50s walked through the doors of her office.
Her symptoms were fever, headache, cough, and significant short of breath.
And in the 15 minutes from when the woman walked in to the time her flu test came back negative,
she was unresponsive and drooling. I had tried to awaken her and she did not awaken. She continued to have like altered status the whole time and would stop breathing, and I'd have to sternal rubber so she would breathe again.
Krieger says an ambulance took the woman to St. Vincent and says as a doctor who has seen a lot, how quickly the woman deteriorated was shocking.
I've trained in the ICU, the cardiac ICU, like codes. I've done CPR on people. I mean, this was scary for me because the onset was just very rapid.
Luckily, the woman survived and is doing better. Krieger says the woman was tested for COVID-19, but those results won't come back for 72 hours. And she hopes if this was coronavirus, people take it seriously.
People need to heed the warnings. I know it sounds far away. I know it's hard to think it's real, but once you see it, it's real.
Dr. Krieger says cleaning has been ramped up here at her office after this incident, and she says she's self-quarantining until those results come back. On the north side, Jenny Drasler, Wish TV News 8.
Scary stuff, Jenny. Thank you very much. Well, between the kids being home from school because of coronavirus and so many people working from home or laid off completely, one of the biggest changes to routines is eating and cooking. So even if you aren't Julia Child or Bobby Flay, it's possible to eat well and not get bored even if you can't go out to a restaurant. Wish TV's Dan Klein joining us now live with some really helpful information, Dan, after talking with some experts.
Yeah, and let's face it, it can be overwhelming for a lot of us to think that we're not going to be able to eat inside of a restaurant for weeks, and especially if you remember the information coming from Dr. Virginia Kane, what she had to say during the Health Spotlight yesterday that we aired on the coronavirus. Her advice that you need 2 weeks of food, water, medication on hand just in case. So let's give you some information that could help lessen that stress. First, plan your meals ahead of time and make a list before you leave the house. That can help your budget as well. Next, don't get crazy, but do get creative. That's the advice from registered dietitian and nutritionist Katie Hake at IU Health. Try some different foods, like maybe red lentil spaghetti instead of pasta, traditional pasta, or purple potatoes to put some new colors and flavors on your plate rather than the same basics you're used to. And don't forget things like crock pots or breakfast for dinner. Third, don't make it harder than it is. Try to get 3 things on your plate. Protein, like meat, eggs, or beans. Starches, like rice, potatoes, or pasta, which are also good sources of carbohydrates. And a vegetable.
Take a minute to sit down and actually write out, what sounds good? What do I have in my pantry already? The internet's a beautiful thing. We're fortunate to have access to that, so look up some different recipes and actually plan out what you're going to have for the week.
Now, one really helpful thing to remember with this 2-week supply of advice is that many foods, even fresh vegetables like broccoli, Brussels sprouts, cauliflower, can be frozen and not lose their nutritional value. One thing, though, you don't want to freeze is any lettuce or fresh salads. Now, coming up all new at 11, I'll give you some helpful hints for parents and for those who find themselves working from home for the first time and possibly ever and for the foreseeable future. And you're just one room away from the pull of the refrigerator. So I'll give you Katie Hake's best tip for how not to eat mindlessly throughout the day. Reporting live, Dan Klein, Wish TV News 8.